I usually don't need a mic. I'm usually loud enough. Hi, everybody. My name is Anjanette DeVito. I am the nurse manager for Santa Clara County's addiction medicine and therapy programs, of which there are 3, and I manage 2 of them. There's another nurse manager that covers the largest of the 3 clinics. I have been a nurse 30 years, 28 in Santa Clara County, and all of it in addiction medicine. So I'd like to say that this is sort of near and dear to my heart. I appreciate that all of you are here. It's not a topic I'm sure anyone thought that when they graduated with their teaching credential thought they would have to talk to their students about drug and alcohol awareness or fentanyl overdoses or anything like that. My younger son is a new teacher. This is his first year teaching. And so we had this conversation at home as he was a student teacher, and he thought the same thing. I didn't know I was going to have to talk to them about that. So I appreciate the difficulty of the conversation, but I'm very happy to be able to provide you with some information about it, and obviously the medication, which has been delivered to campus so that you have that. Should you need it. And, my hope and wish every day is that you don't ever need it while on campus. So let's see if I can. Okay, so I'm not too tech savvy, but look, there we go. So the first place we always like to start is understanding the law around naloxone. And so while that's fine. Thank you. So while Narcan or naloxone, Narcan is the brand name, naloxone the generic name, is a prescription medication, it is not on the scheduled list. So it is not included in the Controlled Substance Act. Okay, so that's important because a prescription is needed. There is a state standing order. We have one in the county by our medical director, and there's also a state order from Dr. Smith that covers the distribution of the medication to you, to the schools, and everybody in Santa Clara County. The medication can be prescribed by anybody who has prescription privileges, so doctors, dentists, veterinarians. AB 1535 is no longer new legislation, but still legislation that says any pharmacy that has a license to prescribe medication can fill a prescription for naloxone. So Walmart, Walgreens, Rite Aid, CVS, if you have local compounding pharmacies or, independent pharmacies, all of them, if they have a license to fill a prescription, can certainly fill this prescription as well. It is covered by 3 insurances currently: Blue Cross Blue Shield, Aetna, and Medi-Cal. There are others coming on board, but they've been very, very slow to respond. And if there's a Medi-Cal involvement, Medi-Cal pays for the prescription in full. If people need to pay for it, with cash, there are sometimes discounts available. Not always, it just depends on the pharmacy. But with every prescription comes a training very similar to this one, as a requirement from the manufacturer. It can be administered by anybody to anybody in a crisis. So while we're all special, and I believe that every one of us is special, you don't need any special letters after your name, RN, PhD, you don't need any of that. You just need to be a person who's willing to help somebody who's potentially in crisis, okay? And then there are additional liability protections in place if the outcome of what you're trying to do is less than optimal. So if the person does not survive, you cannot be sued criminally or civilly, and there is a very large 780-page document that outlines all of that for all of the states, which can be made available if you need a copy of that. Okay. What's an opiate overdose? Very simply, 3 of the most important body systems that you have, your brain, your heart, and your lungs, they all work dependently on one another when things are going well. When there's too much of an opiate on board, those 3 systems start working independently of each other. So the brain may be working, it may be telling the heart to beat, it may not beat, 2 beats, no beat. It may tell your lungs to expand and contract, moving air and oxygen through your system. When there's too much of an opiate, the carbon dioxide levels rise, oxygen levels decrease, causing unconsciousness, coma, and potentially death. By using the naloxone, it kind of brings everything back together. So those three systems go back to working dependently on one another, which in this case, dependency is a good thing. We want that to happen, all right? So that is the goal of the medication and what can come of it when it's used and when it's working well. Okay, so I'm a foodie at heart and I haven't had lunch. So those French fries on your screen represent the opioid receptors, of which there are three: mu, delta, and kappa. That receptor technically takes that, whatever you take in, so whatever you eat, drink, or breathe, goes into that receptor, represented by the green P on the screen, is the opioid. Sits into the receptor, starts to be absorbed by the receptor. Because naloxone has a stronger affinity to the receptor than the opioid, the naloxone will displace the opioid, so kicking it off, sits in the receptor, and now the receptor can only absorb the naloxone, which is what essentially overturns the overdose. So it all is a good thing. At least I like to think so. Who is at risk of overdose and why are they? Well, there's no one not at risk. So every single one of us at some time or another is at risk for an overdose, okay? Doesn't matter our socioeconomic background, race, culture, ethnicity, it makes no difference, all right? People who use opioids for pain control because they're on an opioid all the time, which causes some level of brain fog. You know, they'll put medicine out and think, oh yeah, I took that. And then they'll go back to the counter and think, ooh, I must have forgot that. So it's a very innocent overdose, all right? Young people who are experimenting with drugs, those with drug dependence versus drug addiction, and those who are opiate naive. So someone who has never taken an opiate for any reason, dental work, surgery procedure, small procedure in hospital or in a doctor's office, is somebody considered opiate naive. Longtime drug users, especially those who have periods of abstinence due to time in custody, in the prison system, in hospitals, in drug rehabilitation centers. They come out of those facilities thinking that their level of tolerance is the same, and it is not. So they accidentally overdose more times than I'd like to admit. When people mix medications, so people mix different kinds, it could be all prescription, it could be all illicit, it could be a combination thereof. Those who use illicit or street drugs, those who use alone, people who have physical health issues like respiratory illnesses, asthma, COPD, chronic obstructive pulmonary disease, those who have decreased immune systems due to chemotherapy, autoimmune diseases like lupus, things like that. Those who are malnourished, maybe they're food insecure, they suffer from anorexia or bulimia or some, other condition like that. Those are dehydrated, also from food insecurity as well, or they don't like the taste of water, okay, because that's a real thing for some people. Those who suffer from, weight loss, whether it's weight loss surgery or, again, anorexia, things like that. Those who have cardiac issues, heart attack, stroke, heart disease, anything like that, leads someone to be equally at risk or even more at risk than someone who maybe is just opiate naive. When we were putting together a training class very similar to this for our law enforcement partners, which is where this all started, we quickly realized while they are adept at taking care of us, and taking care of our environment out in the world, we knew that they did not know all of the medications that are potentially available, because no one really does. So we put this table together. It is by no means inclusive of every medication that there is, but it gives you an idea of some of the drugs that fall into the different categories. There's only two naturally occurring opioids. That's morphine and codeine. And from there, everything else is developed or made. When you heat morphine, you get an ester, which is kind of like a residue, and that's where heroin comes from. Methyl disorphine and a very old medication called Velon. You'll really only see that in households where there are multi-generational families living together. The semi-synthetic meds might be more familiar to you. You may have taken one. You may have had a family member take one. Dilaudid, Norco, Percodan, Percocet, Opana, another old school medication really for older people, prescribed predominantly by older docs as well. And then medications that we use in the treatment of addiction, which is buprenorphine or Suboxone. It's the same. The Suboxone has a naloxone component to it, which is a little safer than just buprenorphine by itself. The fully synthetic meds, so somebody who loves science, not me, mixed a bunch of things together and came up with fentanyl. A wonderful anesthesia developed in the late 1950s, still in use today for anesthesia for surgical purposes, but it also has been misappropriated, as I like to say, for evil and not good. A medication we also use in the treatment of addiction, which is methadone, tramadol, and tapentadol. And the one I'll call your attention to on that list is loperamide. It's the chief ingredient in Imodium. So Imodium, unlike Sudafed, is still available over the counter, right? You can walk into Walmart or Walgreens or Rite Aid and for 100 pills for $2.96, and a box warning that says may cause euphoria if used inappropriately. So to a kid, euphoria means high. To the person treating the patient, that's a bowel blockage, a colon obstruction. It is not going to get them high. It is going to get them very, very sick. So in the course of your career, in the course of your day when you're teaching, if you happen to notice a student is absent more than they're not, or they're in and out of the nurse's office, if that's a thing today, there might be that conversation about it, because it's very possible that they are using Imodium as a means to get high or to try and get high. We had two students, or I should say 17-year-olds, I don't know if they were students anymore, 2 years ago, attempt to admit to the methadone clinic, and their drug of choice was Imodium. One crushed it and injected it, and one crushed it and snorted it. So it just causes, all kinds of digestive and bowel issues. So not really what they were looking for, I'm sure. And then there's endogenous opioids, like exercise. It doesn't like me, and I don't like it either, but it's on there. Endorphins, enkephalins, dimorphines, and endomorphines too. Okay. So what is naloxone? It's an opiate antagonist or an opiate blocker, which reverses overdoses in people and can be administered in 4 different methods. IV, which we leave for EMS 911 first responders, because that is direct and that is going to do something that we may not be able to manage, right, in a community setting or in a school setting. Intramuscular, which is syringe and vial. We had done a study group, a focus group some years back with some law enforcement partners, some of my nursing staff, some other community people, and asked them to put together a syringe and then draw up the medication in the vial. Even the nursing staff were like, oh my God, what are we doing? Put the needle on the syringe, take everything out of its packages, draw back the air, push the air forward, clean the top of the vial, pop the top, put it in. And it was like, who's going to do all of that when all of that, adrenaline is pumping, and you're thinking, I just have to save their life. I just have to try and save their life. So we really don't make use or make available intramuscular naloxone, although it is available. I think it's a lot. It's a burden to put on people because of fear that they're not going to do it right. Okay, subcutaneous, like your TB test, so up under the first layer of skin, not really effective because it takes too long for the body to absorb it. And then intranasally, which is the medication that's been provided to your campus. It's short acting. It only lasts in the body 20 to 90 minutes. Although it works in between 3 and 5 minutes, it only lives in the body a very short period of time. Okay. So, and the body will just metabolize out whatever it does not need. The manufacturer says that it causes a sudden withdrawal. If 5 minutes is sudden, I'm not a nurse, because when I think of sudden as a nurse, I think instantaneous. So it's going to be the longest 3 to 5 minutes that you wait. You'll be like, oh God, what time? How fast? What are we doing? Okay. There's a few things we'll do in the meantime, and it does not get a person high. All right. It's not addictive and can't hurt anyone if you deploy it to someone and they don't have any opiates in their system. So if you're on campus and, you're in the parking lot and you see a student or a staff member on the ground and you deploy a dose of Narcan and it's a heart attack, you're not going to hurt them. Okay, the body will just get rid of whatever it does not need. So I don't want anyone to be nervous or afraid of using it. Okay. How do we recognize an opiate overdose? By and large, people are unconscious. Okay, you're going to approach the person and they're not going to be awake. But there are cases, and have been documented cases, where the person is awake and looking, but their speech center has been affected, so they can track you, but they can't speak to you. Okay. They may be unresponsive to outside stimuli. So if you watch medical dramas like I do, and you see sternal rubs and foot tapping, they're not responsive to any of those things. If you are CPR certified and CPR trained, you're watching chest rise and fall, you may see the chest rise and fall, and then a few seconds between all of that. And that's okay too. If you're checking a pulse, it may be thready, it may be weak, you may not feel it. You may feel 2 beats and then a skip. You may feel 4 beats and a skip. They may be blue or ashen. In medicine, we call that cyanosis. So you're going to see this blue color, much like blue sweatshirts I see, or blue t-shirts, much of that color. If your victim is female or wearing nail polish, gel polish, anything on their fingernails, look at their toenails. The cuticle around the toenail will be the same shade of blue or gray. Okay. You may hear a choking sound or a rattling in the back of the throat. We call that agonal breathing. We don't call it a death rattle anymore. So we have to have that fixed. But it's an agonal breath. They can't really exchange the air and it gets trapped in the back of the throat. So they're not really moving air around very well. They could be vomiting. They could have slack muscle. So you will engage the limb, arm, leg, whatever, and you hold it up. And if you let go, you expect the person to engage the muscle and hold it up, and they cannot. It drops to the ground. All right. And then we talked about pulses already, and we talked about fingernails and cyanosis and things like that. So you're going to think, is the person responsive? Start CPR, right? Shake and shout. Hey, 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 are you okay? Are you okay? And in this instance, I recommend tapping from the bottom of the foot rather than approaching somebody, and grabbing them by the shoulder, because you just don't know. If someone is overdosing, the first reaction to that big intake of air is for their arms to flail, and we don't want somebody hurt. Right, because it's been misconstrued as, oh, they hit me. They're not intending to hit you. It's an unexpected response sometimes. Can this person speak to you? And then what do they look like? Skin, fingernails, things like that we talked about. So you're going to check for the signs of opiate overdose. You're going to support the person's breathing by putting them in recovery position, which is like that. On their side, left leg bent in a 90-degree angle with their face parallel to the ground, so that if they vomit, they're vomiting outward and they're not aspirating anything, which is important, all right? And then you're going to start the chain of survival. Call 911, even if you have to leave the person. Oftentimes in clinic, I will leave my cell phone on my desk because there's phones everywhere, and I will be needed in the hallway for something where there is no phone. If you have to leave them, it's better to leave them and call 911 and tell the dispatcher what you're experiencing than not, okay? So deploy the first dose of Narcan, there are 2 in the box, and then start CPR if CPR is needed, okay? Monitor their response, recovery position, all right, and things like that, and then stay with them. So, opiate antagonist or an opiate blocker is what naloxone is, which reverses overdoses in people. There's 4 methods of delivery, as we said. It is not sudden, but it's sudden withdrawal, in someone who's used opiates, and it doesn't get a person high. So please use it if you think it's necessary. All right, so most of this slide we've already talked about. If you actively resuscitate somebody and they get up and walk away from the scene before 911 or EMS gets there, just let them go, okay? EMS will take care of putting out a notice to be on the lookout for that person, but we can't force people to take treatment if they don't want it. So that's just be mindful. I don't want anyone to get hurt trying to do something else. And then the most important bullet point on this is the long-acting medications. So there are some long-acting meds like methadone, like sustained-release morphine, like extended-release hydromorphone that may cause something called secondary overdose. So you may do a great job resuscitating them and reversing the overdose, and you're having a conversation while you're waiting for EMS, and they become unresponsive again. That's why there's 2 doses in the box. We'll talk about that in a second. And then if you need to deploy the second dose of naloxone, right, you wait 3 to 5 minutes, and ironically that works out to 10 minutes. And EMS duty chief Mike Cabano, who's our liaison, tells me that there is a 10-minute and 59-second response time in Santa Clara County for EMS from the top of Palo Alto to the bottom of Gilroy. So no matter where you are in the county, they should be to you in about 10 minutes and 59 seconds. So those 2 5-minute things work kind of closely together. And I'm sure because you're a school, something is, EMS is closer than 10 minutes and 59 seconds. Okay. That's how to find us if you need something else or you need to refer someone to treatment. Someone's talking to you and they feel like they need some support. You can call our office. Those are the clinic phone numbers. My email is there. You're welcome to call there. If I can answer a question or, help out in some capacity. Okay, so this, I know it's going to be hard for you to see this. I get it. This is what a box of naloxone looks like. The important things to note on here is if you forget the conversation we're having, open the box. The instructions are right here on the front. Okay. At the top of the box is a lot number and expiration date, which is really important because we don't ever want to use expired meds. You will see bulletins from Adaptopharm or Emergent, which is the parent company, or the FDA that says it's okay to use it past its expiration date. But a person with a license is never going to tell you to do that because I'm not going to do that. All right. We don't know the efficacy of expired medication or the efficacy of this expired medication. And so I don't know, because I'm also not a lawyer, how those liability protections work if we use expired meds and it's proven through autopsy that that person's life could have been saved, right? So I don't want any one of you in that predicament. So don't use expired meds. You're going to reach out to whoever manages, this medication, whether it's the health office, whether it's the superintendent or the principal or whoever, about a month before the kits expire. And I'm sure that they'll make arrangements to do that if you think the medication's going to expire so that we can work on getting unexpired meds to you. Inside the box, yes, 2.5 years currently. So a very long time, which is good. We did ask. It used to be 18 months. And by the time I was doing some of the trainings with it, it was expiring faster than I could get it out there. So we asked for something a little longer and they were already working on it. So it worked out kind of good. So inside the box, 2 kits, just like this. Lot number and expiration date noted on the bottom right here. And then when you open these, there's a lot number and expiration date right on this black strip. And I realize this is super hard to see, okay? Also right here, which is important because when there's all that adrenaline flowing around, the box gets thrown, from personal experience, of course. The package gets thrown. Just hold on to the applicator, or you have to remember who was sitting here with you to go, oh, I need to ask them, okay? Just hold on to this. This is, obviously intranasal, goes in your nose. Your nose is a mucous membrane. So this is deployed by pressing this red button into a V-shaped pattern into the nose. The mucous membrane in the nose will absorb it. And that's really the mechanism of action for the meds. And then inside also that package is this also instruction sheet. And I usually give this to wherever I'm, having this conversation because it can be copied, laminated, and posted anywhere where there's students or staff or wherever you think, public areas of the campus. And I think it's just an, unfortunately part of what's the landscape of our life these days, if you will. So, questions? Yes. You would start CPR prior to that, right? Deploy, start CPR if you need to. Don't worry about recovery position if you're doing CPR. Okay, so just leave them on their back. Good question. No one's ever asked me that. Anybody else? Yes. Anybody can be trained. Typically we say age 12 and up. Speaking of age, also a good question. It can be used on anyone age 6 months to however old, weight range 20 pounds, because that's the average weight of a 6-month-old, to however much they weigh. So there's really no age requirement. Yes. Doesn't make a difference. Yeah, it doesn't matter. Just the goal is to get the medicine in. So they've taken away left, right, doesn't matter. Yes. A lot more at schools than I ever would have thought. So in January, a Stanford University student lost their life. Two Los Gatos students at the beginning of the school year had overdosed on campus. So the medication has been used there. We had 6 students in Gilroy at the end of last school year overdose, 2 of which passed away. Way more than I expected, honestly. This was something unexpected for me. So, we can certainly do that. Yeah, not a problem. Yes. So when the medication is deployed, it deploys this way. Yep. Yes. That's up to your leadership. So, as an aside to that, people can come to clinic, any one of the 3 clinics that we have in the county, and get a Narcan kit free of charge. So, if that insurance thing is a barrier for some people, we don't want it to be. They just need to come to the clinic. Okay. Yes. Yeah. It doesn't make a difference. No. Right. I think that was the whole thing is like, oh my God, how much more can I remember? No, at that point, pick a side. If you like the left, stick it in the left. It's fine. If you like the right, put it there too. Makes no difference. Any other questions? I'm trying to be mindful of time. Yeah. Okay. So the question was, how often is this happening on campuses across the county? A lot. I think to summarize, to the short answer, a lot more than we expected. Okay. Yes, we can do that. Oh, sorry. Repeat the question. See, I didn't follow the directions very well. The question was, can clubs and students get the medication or have the medication made available to them so that they can take it off campus? Yes, they can. So the question was, if you need the second dose, does it matter what side of their nose you put the second dose in? It does not. Pick a side. Then the question there was V-shaped pattern. That one I did remember in its entirety. V-shaped pattern up or down for deployment? Up. It's a V-shape upward. And then question back there. So the question was, how would you administer CPR to someone that we've put into recovery position? Put them on their back, okay, and administer CPR that way. Did we get all the questions? Oh. So based on the question about clubs and groups and ages, there is an age range for the use of medication, age 6 months to however long, and then the corresponding weight is 20 pounds to however much the person weighs. It can be used on an infant if necessary, but you're not going to encompass that, so you're fine. Okay. The question is, how old does someone need to be to administer the medication to another person? And right now, the state standard is 12. There's a question back there. Yes, ma'am. Correct. Yeah, I was trying to formulate an answer for her because I have a license. So it's, Yeah. So the question is, if all you have is unexpired medication, should you use it? I guess I would say yes, because it's probably better than nothing, right? But I would definitely make sure somebody is calling 911 and telling them that you deployed a dose of medication that happens to be expired, so that they realize the how to prioritize that question, that call. Oh, yes, please. They can. Oh, sorry. The question is about age. Gosh, I'm just so used to answering the questions. Can a high school person come to clinic and pick up the medication? They absolutely can. They're going to be asked to sign a acknowledgement, okay, that they got a kit. They do not have to use their real name. I will say that. Okay, but they have to have a name because that's the state's tracking tool. So I have to provide them how many kits we've dispensed or that we've given out, so that I can get more from the state. So it's just an acknowledgement, but they absolutely can. Anyone from the age of 12. Yes, sir. So the question is, there was a situation in Florida where somebody was giving mouth to mouth resuscitation and potentially got exposed to an overdose due to fentanyl being on the person's mouth. I'm guessing, right? So, because it's a mucous membrane, which is what your mouth is, there is the possibility of that. But CPR now can be compressions only. So the risk is small, right? The risk is really very small for contamination like that, but you can do CPR with just chest compressions. Rescue breathing is sometimes optional. Yep. So the question is, where are the 3 clinics in Santa Clara County? So we have one clinic which is on the campus of Valley Medical Center. One clinic is on the east side of San Jose, next to Regional Brothers. And then we have one clinic in South County in San Martin. I'm happy to send a list of the addresses that can be distributed to you. Absolutely. And then the PowerPoint also, it's open sourced. I wrote it, so you're welcome to take it and use it however you need to. If you have a class, if you're a health educator, if you're a PE teacher and you want to incorporate this, by all means, go ahead and use it. Oh, yes. Question? Okay. So the question is, of all of the data that we collected, how are students or this age group using the illicit or the illegal drug? It's pill form. It's pill form. Okay, so you are all, I'm sure, quite familiar with rainbow fentanyl at this point, right? Rainbow fentanyl is medication that is it's counterfeit. Okay, it's counterfeit pills shaped either in like a bar of Xanax or a round pill or something like that, cut with fentanyl, but colored like Skittles. It's used for admission to parties called Skittles parties. So really, it's oral, it's pill form, because the issue becomes, we don't know what's in the medicine or how much, right? So in a bar of Xanax, which can be cut into 4 quarters because that's the small dosage, and somebody mixes fentanyl in there, well, the person who's doing this is not going, let's see, you need 0.25 here, 0.25. No, it's like cake batter. They're putting it in a bowl, mixing it all up, putting it in a mold, and just hoping for the best. So in one situation, we have done some education. 4 kids took a quarter, and only one child lost his life because all the fentanyl was on that end. So it's pill form. And we've seen that in clinic, right? To further bring your point, we have seen in clinic, predominantly addiction medicine clinics started around methadone and heroin and things like that, injectable, right? Injectable kind of drugs. But we've seen a shift over the last 4.5 years, maybe, to more pill-based or oral medication issues than we do with injectables anymore. Any other questions? It doesn't look like there are any, but if there are, my email address is in there. So is my office number. You're welcome to call or drop an email. If you're in San Jose, you're welcome to stop by the office as well. We're happy to have you there. If there is anything else, just let me know. Thank you so much for having me.